All right. All right. So I'm here with Miss Cassie Robinson. And if you could just kind of start by telling a little bit about your background and what you currently do and how you got there.
Sure. Like I said, my name is Cassie Robinson. I've been in this field for over 30 years. I have a degree in microbiology from Clemson, and I have a master's degree in pharmaceutical manufacturing from Stevens Institute of Technology. I started as a microbiology technician at Bausch& Lomb. I was there at Bausch& Lomb for 16 years. I worked in various departments from, of course, microbiology. I did validation, and then I returned to the lab in a management capacity as a supervisor. So that was the Bausch& Lomb. And then to come to Columbia, to come to Right Dose, I actually only changed careers because I met my husband and we decided to make Columbia our home. Um, Right Dose had some of the same technology. It was pharmaceutical manufacturing, so it wasn't that it was a big jump from Bausch& Lomb. So I came here as a microbiology manager. I've worked in quality assurance here. I've been a quality control director, and now I'm a sterility assurance director.
Okay. Thank you. So you mentioned that it's not a typical microbiology type position. Can you tell me a little bit more about what that means?
So, a lot of times when you go to college, you think microbiology, you're going to be in a lab and you will be, doing plates all day and you're just going to find organisms and you're going to synthesize organisms and that type thing. But it's actually pretty physical, especially when you're entry level. Whenever we have people interviewing or I'm interviewing someone, I'm always making sure have them understand pharmaceutical manufacturing. Um, we are taking samples. We sample the walls, the floor, people, water, the air, but we use instruments, and there's a lot of you physically bending down, taking samples. It will, because we're in a regulated industry, it will take you longer to document that you took the sample than it took you to take the sample. But there's a lot of walking. You're putting up samples, you're carrying. And that's why I say it's not your typical where you're in a lab all day. Actually, most of our microbiologists, when they start, that's really the last place that they are. They are out getting samples. We make product for we're a sterile manufacturer. So it's very important that we manage and we are testing our environment. And so that's the main thing. Did I answer your
Wow.
question?
Yeah.
Okay.
I had never really thought about, I mean, you have to make sure when you're manufacturing medication and stuff for people that you're doing it in something that's sterile. And I had not thought about the degree of testing that would take of your environment. So that's actually
Right.
really interesting.
But it's not your typical where you're doing a lot of research.
Yeah.
We do have a research component, but mostly when research for us means that we are developing a test to ensure that if, let's say, there had been a microorganism present, we could recover it. A lot of times your test method could kill the microorganisms, and you don't want that. That would mean you would be getting a false negative, meaning, there was really something there, but whatever your test was actually killed it. So we put a lot of emphasis in that we have to be able to recover organisms that would be similar to the ones we'd find in our environment. And also similar, we have what we call ATCC organisms that we use.
Wow. Okay. Well, what was it that motivated you to pursue a career in microbiology?
So way, way long time ago, I was, I thought I wanted to be a doctor. And so when I attended Clemson, that was my first thought that I was going to go to med school. And I will admit, probably within my first month, I, for some reason, knew as a freshman that I didn't think I wanted, I knew I did not want to dedicate my life to people that way.
Mhm.
There's a twist in that. um, and so, but I did like science. I like microbiology. So I would have stayed in micro or something or biology regardless, but I stayed in microbiology. While there, you were able to experience some of the careers. A lot of it was food microbiology. They talk about some industrial, but it's funny that Bosch Alam was right down the road from Clemson, and that part of that pharmaceutical manufacturing was not, but you have to realize this is a long time ago, it was not a part of anything that was discussed. So, but that's the reason I was in microbiology. So,
Okay,
yeah.
cool. What were some of the most pivotal, I can't talk, pivotal decisions that shaped your career path?
So, I think you were asking something I was looking at was um, how do you start your career?
Mhm.
So literally, it was one day opening the paper. I was actually a manager at Walmart in the shoe department, and I was actually moving up in that part of it. However, one day I see an ad for Bosch and Lomb Microtech. I put in for it, and I get the job. So it's not that I would say my career I chose so much, but it somewhat chose me at that
Okay.
point. When I arrived there, I loved what I was doing. Um, Walmart, I was a good manager, but
Mhm.
it wasn't science. And so I found that, I love doing everything when I started in at Bausch& and Lomb.
What is it that you got to do at Bausch& and Lomb?
So, same, I started out doing environmental monitoring, meaning when I was talking about that physical aspect, I was taking samples. I got to test water samples, test product samples. I got to, perform identification. But another something that happened when you ask about what might have been something pivotal is that my manager at the time, although I was the least senior person there, I was just curious. I would work. I even helped the chemistry lab. I learned chemistry well. I did everything. And a project came up, and so this is a long time ago. So we were changing technologies on how we test sterility. And he chose me to be a microbiologist to work on that project. And so that actually exposed me to, other people in the industry. I learned about validation, which would be my next job at Bausch&
Okay.
and but it was that was probably one of the pivotal things. That was a turning point. I didn't know it at the time, but it was. But
Right.
it because that at that point that technology was so new that there were only maybe three of that type of pieces of equipment in America. Even though the technology had been there, no one was using that particular isolator. So from that, I was able to actually present at like Parental Drug Association. I think I did something for ISPE. So it actually helped move me along in that way.
Wow. Cool. Are there any industries or roles that you wish you had explored earlier in your career?
I wish I had known about project management.
Ah, okay.
I think I would have excelled in project management. Because that's what you do as a microbiologist. You have to plan your day I mean, that is a part of you. It's what lines are running, what media do I need to use. You have to have your day planned. You have to have your projects planned before you start. Because if you get in the middle of something and then you forget something, for us, it means gowning up again, or it means I may have to lose a whole day of testing because I didn't plan appropriately. So, I wish I had explored that. I just didn't
Okay.
know that was an option back then.
Yeah. Yeah, now it seems like it's a really big deal for everything. People want project management
Mm-hmm.
experience, so that makes sense.
Yes.
Um, are there any technical skills or certifications or lab techniques that you think would be really valuable for people in the job market right now or within the next year or so?
So AI seems to be taking everything over. Um, and also just understanding, its limitations. So you still need to have a base understanding. You can't go into this not knowing, what a GPC or a gram-positive cocci is. So you need to know that, even though it will tell you, but you still need to know. There's nothing still about walking and you being able to look at the plate, but I'm sure it'll be a time you can take a picture of the plate and it can probably tell you what it is. There are technologies now where for microbiology, it's a lot of chemistry based. When I started, I had to do a lot of gram staining and trying
Mhm.
to figure out what the ID was. Now, we have mass specs that perform our identification. So literally, you take a few microliters of an organism, you put it on a small card, and within 15 to 20 minutes, you have an ID.
Mhm.
So, you don't even have to do the gram stain step anymore longer. But even
Wow.
those databases are only as good as the databases are updated. And so you
Mhm.
still need to know, do I know all the biochemical tests that I need to perform if I'm trying to figure out what this organism is? You need to understand, what type of environment did it come from? And yes, you can study that, but a lot of it is from experience. When you have a
Mhm.
problem with a person and you can't get them to pass their gowning, what's the problem? So,
Mhm.
and a lot of times that's just you interviewing the person. Now, can AI help you with those questions that you may need? But you still need those real world skills when you're dealing with that we're still manufacturing something that requires a human interaction.
Gotcha. This is this was not something that I sent you in advance, but what type of training program do y'all have in the various roles there?
So, like I was speaking, for a person coming in, entry level. This current job, and even at Bosch Alarm, you have what we call, I guess, you're reading our procedures because we're in a regulated industry.
Mhm.
So everything we do is scrutinized, meaning the training program has been specified. You will, know how to document, and then we will take you in. You will learn how to gown properly. And then, but you have to be sampled, are you able to pass the gowning? And then it comes to, for us, it's taking samples. Do you know how to take a sample aseptically? So we will practice in hoods at first, but at that point, we'll take you in with a trained analyst or a supervisor, and they will then show you how to do it. And then after we've shown you how to do it, and then we will, okay, now you show us how to do it. So there's a lot of OJT. There's
Mhm.
requalification. As you move, there are other testing, like you actually start to test products. So usually we start with the basics. Can you take an air sample? Then, okay, now we're going to use all those aseptic techniques that you learn to learn how to test product. Remember, I said we have to sample the water. Well, if you sample the water and you're putting your organisms in the water, it's not a representation of the sample. So aseptic technique is a base of what we do. Also for us, it's that knowing, and something else is knowing if something's just not right.
Gotcha.
I think that's something that some people miss, but we teach that. If something goes wrong, if you see something wrong, you have to say something. And so a lot of times, yes, we can show you some examples, and that's why I say it's always good for someone to come in. You start inside. A lot of times we get, oh, I have a master's degree or I have this, but you know, our entry level analysts, already know more because they've
Mhm.
been inside. Um,
Right.
but it's a training. As you move up, there are different levels. You're going to read different SOPs. You're going to be exposed to other departments. Um, validation is one of those departments where you actually get to see the entire process. Validation just means that we ensure that our processes are operating in the way that they should, and we do them at different, we evaluate them like on a, maybe this is the minimal and this is the maximum that you would see in a parameter. But we do that when we initially get something, and then there's usually a requalification cycle. But because you get to touch every part of it, meaning the filling, the environment, the software, electrical, all of that's in validation. That so that when you talk about something that was a pivotal moment, it was moving to validation. I was at that point able to touch everything. I was immersed in our operations. I was immersed in, we had a new product. Um, so it taught me so much about pharmaceutical manufacturing because I was actually doing a little bit of everything that went into that's what makes that product. So
Wow.
yeah.
Wow. That sounds very interesting. I'm just intrigued by all of it. So, um, what's a typical day look like in your role? Is
My
there a
current,
typical day?
no, I was gonna say the typical day is that is not typical. There's always meetings at
Mhm,
this level. There's always meetings. You move from being a tester. Now I've moved from being so much a manager. Part of your role as a director is to be strategic,
mhm,
but there are a lot of meetings. And so I feel that that's because I have to, just because I'm in microbiology, what I'm doing, or now I have lab compliance, what we're doing impacts everyone else. If an analyst misses a line, if an analyst didn't show up at the line at the right time, we can actually, the line can't stop. Then now the production schedule's off. Um, Vice, or could be vice versa. The analyst sees something wrong. We need to stop the line. Now I need to make sure we had a problem, a product didn't pass. Whatever that might be, we have to be able to communicate that. But it's
mhm,
being in relation with, operations. I'm really in what we call quality control. Um, working with QA all the time. But at this level, um, it's one of those things, if packaging's too hot, I might have to go out there and sample it or make sure that that's okay. So
yeah,
at this level, the routine is, I know I'm going to be in meetings probably 50% of my time.
okay,
There's going to be that part of time when, my direct reports need me. And then there's going to be that time when somebody else's direct reports may need me. So, but that's pretty much how it is.
okay. Let's see. What areas of microbiology do you see growing the fastest?
I think that biotech, it's always going to be, now that we are using organisms in medicine, and I think that's the new frontier. Like, how do we use different organisms to attack, cancers or
Mhm,
um, whatever that might be. And I remember when they started using Botox, and I remember I was like, oh my gosh, who would do that? But
yeah,
that was just, like one of those starts. Now
mhm,
there are certain, if you think about cells, I mean, that's microorganisms or cells, and I really believe that's going to be used more. And I think that the more it's embraced, I think that so not to be afraid of organisms, but if we learn how to put more control over them, and we use the good parts that they give us, like they can replicate. So if you have something that you need to kill, they can replicate quickly to surround it. It's just
mhm.
that being able um to use those technologies. And that's the other microbiology that we don't do here. um,
Yeah,
but that's the kind, I think when most people think of microbiology, that's what they're thinking about. I'm going to be in research and I'm going to do that.
yeah,
But we're more about, we're contamination control. We're about, how do I make sure that when you know some baby is using our product, that it is not filled with microorganisms.
Right.
And that's our bottom line.
Oh, and that's really why they're having us doing this assignment is showing us all the different ways that microbiology is used in careers. Because you just don't know because I don't have a career in microbiology yet. So um, let's see. What professional organizations or networking opportunities would you recommend?
So I would recommend ASM, American Society of Microbiologists. I always would recommend PDA, Parental Drug Association. And if
Okay.
you're a student, you can actually get like student memberships. You can go to
Yes.
training for like a lot less, but that also gives you exposure to, the regulatory agencies, different types of companies. It also gives you exposure to their publications, so you understand what they're looking for. But Parental Drug Association is about really, how are we making drugs that go into, to bodies, and how are we sure that our drug supply is safe. I mean, that's what the bottom line comes to, and how we work with regulatory agencies. And so those will be the two big ones. Um, I would say also that if there are any, management type, if that's where you want to go.
Hmm.
Sometimes, you're in micro and you're like, I don't want to deal with people. So if you don't want to deal with people, um, management's not where to go.
Right.
um, I thought earlier when you asked me, why did I decided not to be a doctor because I didn't want to dedicate my life to people. But in the end, I've dedicated my life to people.
Yes.
Um, the personnel and people I feel like are above and, maybe are my direct reports. I feel like even, the decisions I make impact them and they're a part of me. So,
Hmm.
I was taught by one of someone I reported to that make a quality, especially if you make a bad decision, it's not just impacting you, it's impacting everyone here. And how many families do they have? So it's not just the patient, it's also people that we work and we call our work family. And so those are the type things you have to take on if you decide to do any type of management, you want to work with people. But I say, hey, any human resource, or if
Hmm.
that's a path that you decide, you're like, hey, I really do like managing, and like I was talking with the project management, I would get into those types. But there's also ISPE
Okay.
for our industry, and that's another organization that you can get involved with.
Okay. Thank you. What has been most valuable to you in your career? And we kind of maybe touched on that a little bit, but I really just want to figure out what is it that helped you attain your goals?
So knowing that, I think it's more of a philosophical reason, though. It's not so much, it's not money because you wouldn't do it because you work the hours.
Yeah.
It's more about, you have a purpose. The purpose is, I know that I'm making something and it's a part of a bigger program. I'm doing something that's going to help other people. But it's not just help the patient, it's also now it's I need to be able to help the next generation. And like
Hmm.
you said, I said I've been doing this over 30 years. So I've always loved being able to teach. I love being able to also learn. So I remember, like as new technologies come, I learned from direct reports, and I love going down to the lab and you find a new analyst and it's like, oh, well, yeah, okay, that's still within the bounds of what we do. But just getting new ideas. And so I think the part of being able to have creativity within the regulatory guidelines, that's helped me to get to my goals. I was saying how even when I started, I used to go and learn certain chemistry tests. I also used to learn validation tests. So I was always trying to do, I would say, my next job before ever um, the job was there.
Mhm.
just because it was like just wanted to soak up knowledge. And I still have that passion even after all these years. Like right now, it's like, gosh, I wouldn't mind learning. I know operations, but um, what is it about operations that I could do to impact and help my company? And so it's always just that willingness to want to learn more. And this is an industry where you can learn more. And so I think that that helps you attain your career goals. But I think I do wanted to backtrack, and you asked one thing I wish I had done. I don't know. I always think you are where you're supposed to be, but maybe not, maybe being able to move to a new opportunity if offered.
Okay.
I'm a very loyal person, so I was at Bosch and Lomb 16 years, and now I've been here 16, 17 years. So maybe, loyalty is valued, yes.
Yes.
But I think that also getting the experience from other industries is
Mhm.
also valuable. Yeah, that's
Okay.
so valuable. You know.
Yeah.
I don't ever suggest job hopping,
Right.
but
Right.
just to have different opportunities and to experience different parts of the industry. Even in pharmaceutical manufacturing, they're different. Like, they're you can do what we call traditional fill. You could be doing a parental fill. You could be doing an advanced using advanced, aseptic processing. So they're different processes within pharmaceutical manufacturing. So
Gotcha. So just to kind of give you a just a broader scope of understanding even within the pharmaceutical industry.
yeah. Yeah, and
Okay.
and it's not to be, it's not anything to be intimidated by. A process is a process is a process. But it is learning it, and you're like, oh, okay. Another thing is learning lean manufacturing is something else that I think can be used in science, and sometimes we shy away from it, but
Mhm.
it's very helpful to know your efficiencies when you're in a science program.
Okay. Do you find that the technology advances are going at a rate that's really hard to keep up with in terms of learning it as it comes out?
No, I think it might be more, um, I think that for me, it's probably not fast enough, but I think that because you're in a regulated industry, there may be more, it takes longer for it to be used because
Okay.
things have to be vetted and vetted and vetted. Yes, we have something that's working. When you introduce something new, there's a lot of change controls, but even before you get there, how will this technology impact my process? And are there any parts of it that will, actually be a detriment and not an improvement? Or is there
Mhm.
something that could, like we were talking about the net, is there something that could be masked by this technology? And so I think it takes a little bit longer when you're in a regulated industry. And when you're doing research, that's just, you can, you have got almost carte blanche. So, but here, it's like, and it's also a major investment of time and money. And so
Right.
that has to be weighed in what's going to be my benefit. So, but I think that for us, there's nothing coming out that's just you couldn't learn or it's so fast that you can't learn.
Gotcha. That makes sense. So what is the part of your job that no one warned you about that you wish you had known?
I think it's the people part. Um, you know, the it's like you don't realize how much of your time you will dedicate to people, but they are the most important part of your job. Not just the people who are in your direct reporting line, it's also the people around you. And I think that would be um like, yeah, there's sometimes that even if you're maybe not as a little socially awkward on certain things, those are the things you still have to have those soft skills. And
Mhm.
so I think those are the because we are technical and you're not really uh, told about having the need for those soft skills. And
Yeah.
so, we can learn things. you can learn things, you're going to grasp knowledge, but it's sometimes those little intangibles that may be a part of a career changing moment for you. And it's okay, how do I make myself more comfortable when I'm in the presence of a CEO? Or how do I
Mhm.
make myself more comfortable when the engineers are talking? And so it's being able to navigate those circles. And I think that's
Mhm.
the part that, no, you kind of leave that part out, like, oh, yeah. So
Okay. Um, I think that a lot of times, and this is for me, so I just kind of assume, I think a lot of times people involved with more sciencey type professions are a lot more introverted, and it's a lot harder for them to push themselves outward and talk to other humans. So that makes a lot of sense for that people part being something that's it's hard to navigate.
it is. And
So
like you said, you are introverted. You're usually like, I want to read an article, or I want to watch this grow, or we
yes,
get excited if we see something different, like,
yes,
and no, and so, and then when you're in a different circle, it's like they really don't care about that. No, just kidding.
right, right, yeah. All right, so let's see. This is the last question.
Okay.
What advice would you give to someone just starting out in microbiology who wants to keep their career options open? Or any type of advice that you would want to give to somebody in a
And
microbiology
so
path?
I think the key word is open. So, and also patience.
Mhm,
I think sometimes now we're in this, instant society, and we're in science, and things are rarely instant in science. It takes time. It takes years to get a drug through. And although you in our industry, we are built on doing it the same way over and over again. And so it's not to get lost in the repetition. It's what am I seeing and what am I learning? And also I think it's important to understand the value of finding mentors in your path. So just if you're in a company, look for that manager that may not be in microbiology, they may be in operations. And, it's like, hey, or do you have an hour for me? Or do you have 30 minutes for me? And make different connections, no matter what job you have, but you make different connections because we're not on an island. Like I said, microbiology goes in nearly every part of this plant. You know,
mhm,
we have something to do with everybody. And so it makes sense that, well, I should maybe learn more about how does the BFS work or equipment work, or,
mhm,
is there some project that maybe I can be a part of, that, and it may be not in your routine hours. And
okay.
I think that's my advice, is that be open to what's around you. Like I was talking about project management. I always think, well, who else better to be a project manager than a microbiologist
Yeah,
or a scientist or a chemist? Um, and also just know that the other sciences are very important in microbiology. And
mhm,
so knowing that biochemistry and understanding that now technologies are coming from everywhere, whatever it may mean, that it's not just, oh, I need to know microorganisms. No, you need to know your chemistry, you need to know a little bit of engineering, when
mhm,
you're understanding about room classes. So that would be, it's just find and never give up that fire to learn, and I think that would be my advice to someone.
okay. Keep that curiosity going.
Have to.
Yeah, awesome. Well, that's all the questions that I have for you. Is there
Okay.
anything that you wanna ask?
No, I just want to be sure that I adequately answered your questions.
Absolutely.
Okay.
Um, I'm And I'm still interested in right dose, so
Well, I mean, always check our
I
website.
do. I do. So,
Okay. I mean, the only thing usually is that, remember I was telling you, is that a lot of times to get in, the hours are off shift,
mhm.
you know, and a lot of people, and we're 24/7. So that
Yeah.
might be the other thing people don't tell. Yeah. And even as in this role, I always say I'm never off. I'm
Yeah.
only off if the plant closes
Oh,
because
wow.
in my head, that's how I feel because
Right.
I'm going to check emails. I'm going to be sure that everything's operating correctly. So, I was away this weekend. I'm still going to check the email every now and then, just to be sure. Okay, and they have my number, so they have contact. Yes, I
Yeah.
have received calls at 3 o'clock in the morning because something's wrong. Um,
Yeah.
so those are the things, but a lot of times, in this industry, a lot of those positions, because we're running 24/7, it's nights and weekends.
Mhm.
Sometimes you get on a cycle and you move through and you're on first
Right.
shift before you know it. But
Right. I've
so,
always joked with people I'm more of a night shifter personally,
uh,
so that is actually wonderful to hear that you have night
well, I
shift
mean,
hours.
like I say, check us out. We're a great company. We're a great company. So I look forward to perhaps one day seeing your resume come across.
Perhaps, perhaps. Hopefully, I'll be done with my program in May, so I'm still kind of looking, keeping some things open, and we'll see what
Hmm.
happens.
All right then.
But thank you so much, Ms. Robinson. I greatly enjoyed this.
Well, I'm
I
glad I
I
did
learned a
too.
lot.
All right. Well, like I said, I'm always close. So if you need any help, just let me know, okay?
All right, thank you. Have a great day.
You too. Bye bye.